Well, if there's a lot of blood in there, a lot of blood's leaving, so your veins tend to get a lot bigger on that side. So if you do notice a change in your veins and or your vessels around the skin of the breast, that's something to be concerned about. That's kind of rare, but I have seen it happen before. Most common presenting sign, like I talked about a minute ago, the most common is an abnormal mammogram. Sorry, I forgot, I put that in there. Most women do not come in feeling their cancers. Okay, 15 years ago, probably. But with mammography nowadays, if you're coming every year, more than likely it will be picked up on mammography. And it'll be small, there is no way you're going to be able to feel it. The second most common region is going to be feeling the lump. And typically, if you feel a lump, it's going to be bigger than what we would be able to detect on the mammogram, and or it's going to be close to the skin. And the reason being, obviously, it's more superficial, you can feel it, versus it deep down into the breast and you can't feel it until it gets big enough. Some of the less common things are the skin changes, discharge, which I didn't go over. That one to me is pretty important because women have discharge all the time. There's multiple colors and multiple reasons. The most common cause of discharge is hormones. And hormonal discharge can be white, it can be clear, it can be yellow, it can be green, I mean seriously, and usually it's on both sides. The one to be concerned about, the one you want to address more, is when it comes out of one side and it's bloody. That's the one that is typically the one that will be a cancer. If not, there's another little benign thing that can do that as well. Okay, who should get a mammogram? This typically, and I may end up skipping over a little bit of this, you start your annual mammograms at age 40 and typically go every year after that until you get to an age of where health-wise there's no reason to get a mammogram. There's not really a cutoff time, so we don't say at age 80 you're done. Well, if you're at age 80 or 85 and you still have a long lifespan, you're still healthy, you're still going, well, of course, you're probably going to come in and get a mammogram. And also, people with stronger family history will probably start screening a little bit earlier. And this would be like if your mom was diagnosed with breast cancer at, say, age 41, you would probably start 10 years younger, 31, and start screening, obviously, a little bit younger. I don't know how many in here. How many in here have had a mammogram? So there's a few. For those of you that have never had one, and even for those of you that have, I'm just going to kind of go through the basics of what to expect. Because you hear all of these rumors and all of these horror stories about a mammogram. Well, basically, you don't want to wear any deodorant and or powders or lotions over the breast area or under the arms. And we tell that to women all the time, we're like, why do you need that? I'm going to smell bad or whatever. The deodorants and some of the lotions and powders have aluminum in them. And when you see aluminum on an x-ray, it looks like little calcifications in the breast and or under the arm. And that's one of the signs that I look for on a mammogram for cancer. So that's why we don't have you wear deodorant. It's not to make it worse for you. It's actually better for me. We usually say wear 2 pieces. That way you just put on a little gown, you keep your pants on or your shorts on or whatever. And then, let's see what else did I put on there. Oh, that's right. If you do have films done or a mammogram done somewhere else, say you moved here from Dallas and you had your mammogram there the last 3 years, we need those films because I look, I compare, I want to look for change. So it's very, very important to either bring them with you or when you get to the facility, fill out a piece of paper and say, yes, I do have films. I had a lady 2 weeks ago who came in and I noticed something on the mammogram. We called her back and we did her additional films, and because I'm looking at it, I want to know what it is. We did her ultrasound and sure enough it's solid, so I'm going to have to biopsy it and figure out what it is. And she looks at me and she goes, I have films in Abilene. I said, why didn't you tell me? Because I was afraid I wouldn't be able to have one down here because it was less than a year ago. My insurance wasn't going to pay for it. I was like, oh my gosh. So the emotional turmoil that she just went through when I got her films, well, that thing had been there for 4 years. Well, it's not a cancer. It would have already grown and gone haywire. So it's very, very important for comparison films. How are they performed? Basically, you'll undress from the waist up, you put on a gown, you usually go into a little sub-waiting area, and the tech will come get you, and it'll be you and the technologist in the room, and she will perform and position one breast at a time. We end up doing 2 views on each breast, a total of 4 pictures, typically. Sometimes a little bit more depending on your body cavities. Here we go. The x-ray that they take now, it appears on a computer screen inside their room. So they just walk over and they look at your image and they say, great, we got good muscle, there's no motion, okay, move on. And so that's how they do all 4 of those. And as soon as they get their pictures and they look great, they push a button, all of the images are sent to me in my other room on my computer screen, and you're gone. So there's no more waiting on film to develop and sitting there for 15 or 20 minutes. It's very in and out, which is very nice. This is actually a mammography machine that we use over at our facility, and this is a digital machine, and I'll kind of go into the difference between digital and what we used to have, the screen film, but they look identical. The only difference is going to be this little plate right there. It's just a little bit bigger, and for those of you that have had a mammogram, a little bit warmer than the old kind. So we use little pads on there now to help cushion everything and make it a little bit more comfortable. And this is just one of our mammography rooms, and I did this so you can see, this is the screen that will pop up with your image. So she does your mammogram here, she walks over there, sees the image, and moves on. So it's very convenient. Are mammograms painful? Well, they shouldn't be painful. They may be a little uncomfortable, and it's kind of like what I tell women is if you were going to squeeze your arm kind of tight, it doesn't bruise and it doesn't hurt, but it's uncomfortable. You don't want to stand like that too long. Luckily, it only lasts a couple of seconds. If you do bruise, if you get a skin tear, if it hurts, that's not good. I mean, it should not happen. If you get to the point and it is feeling uncomfortable or it's hurting, you tell the technologist, hey, wait a minute, that hurts, and they will stop. I mean, they wanted, and the reason they do the compression, and everybody asks that, is why do we have to do that? Well, number one, it decreases motion. It keeps you from moving around, because if you move around, the x-ray is not going to be very good. It's going to look all blurry. It also takes your breast, which is a 3D image, and it squeezes it down, makes it thinner, and the thinner the tissue, the better the x-rays will penetrate it. The better the x-ray penetrates it, the better the image is for me to look at. So that's the reason for the compression. Oh yeah, this is some good ideas. If you were going to come in and you are having breast pain, or you have breast pain all the time, or you have breast pain during your period, normally the best time to schedule this is the week after you start your period. That way everything's pretty much calmed down. If you still are having breast pain, take a Tylenol, some Advil or ibuprofen about an hour before you come in, and that might actually help if it's uncomfortable. Typically, once I get the images, I look at it, I will review it, I come up with a report. The report will go to your doctor. We, as a facility, are required to send you a letter to let you know that everything was normal, or that you need to come back, or you need a biopsy. And your doctor sometimes will also send you a letter as well. If you don't hear from them, though, don't assume everything is normal. Call your doctor and find out exactly the results. The way we do it at our facility is if I need you to come back for any kind of more imaging, we will call you either that day or the next day and say, hey, look, we need to get you in for some more mammogram pictures and get it taken care of right then and there, so you don't have to wait, a week or two to figure out your results. Okay. Also, let's see what else I was going to. There's one other thing I wanted to mention. Anyway, so this tells you the difference between screening and a diagnostic. I have a good friend in Austin who used to go, and she'd get her diagnostic mammogram every year because it's better than the screening exam. And I looked at her one time and said, what are you talking about? A screening exam, all that means is that you walk in, just like I described, you get your 4 pictures, and you leave. Now, let's say you had a lump. So you come in and now it's a diagnostic. It's just the name of the exam. Because instead what we do is we do your 4 pictures and then we'll take a few extra images over your lump or over the area of pain, or if you have a nipple problem, we'll do some images over the nipple. So it's a little bit more tailored exam. And typically after that you'll end up with an ultrasound maybe. So there'll be a little bit more of a detailed exam. Now, it sounds better, but if you're not having any pain, there's no reason to do all of this extra stuff because there's really nothing we're looking for that's extra. So that is the difference between a screening and a diagnostics. Mammography does play a central role in diagnosing breast cancer. Obviously, it's not the only thing, and the newest machine out now is the digital mammography machine, and that's what I was describing. That's where it goes to the computer, and the computer sends it to me, and let's skip ahead. And I'm going to talk more about, instead of just telling you what digital is, because I think we all know. I mean, we all do computers and do that kind of thing. We used to have to stick the film in there, and the tech would go behind the scenes and actually run the film, and you would have to wait while it's being processed. And if there was a positioning error, there was motion, then they would have to go repeat that, and you'd have to wait again. So the only real difference you guys will see is that it's a lot faster. You're in and out quicker, not having to wait as long. Some of the benefits for me is I can manipulate those images. I can take them and I can magnify them. I can invert the image from a black to white or white to black, depending on what I'm looking for. I can window and level. I can do so many things with one image that with a piece of film, you throw it up, and the only good thing about it, I guess you